Hello everyone. In this presentation, I will explain about the symptoms, risk and prevention from the Zika virus. So first of all, what is Zika virus? Zika virus first identified in Uganda in 1947. This virus is transmitted by the same type of the mosquito that carries the dengue fever and the yellow fever. In this disease, the mosquito bites to the infected person, and from the infected person, it transfers towards the healthy person when the mosquito bites. So it's a mosquito-borne virus, and the species that responsible for this disease is called the Aedes species. I also mention it with the red mark. So what is the quality of this mosquito? This mosquito are the aggressive daytime biter. It's mean that the infection can cause in the daytime, and somehow we observed that it can bites in the night also. But the main problem is that there is no any vaccine or medicine available for the treatment of the Zika virus. So that's a very important and very major problem of the Zika virus. Symptoms of the Zika virus. So many people infected with the Zika virus would not have a symptom or will only have a mild symptoms. So the symptoms are similar to other arbovirus borne diseases, like you have observed in the dengue fever, in the yellow fever. What you observe is the simple that you have fever, and another thing is that you also have a pain in your joints, and another thing is you have the red eyes. This type of the disease is called conjunctivitis, and another symptom is the rashes in your body, but the main problem of the Zika virus is that the symptoms can be observed within 3 to 7 days. So after 3 to 7 days you cannot diagnose the patient with the Zika virus. So it can also be observed that 1 out of the 5 patients are diagnosed is diagnosed with the Zika virus, because the symptoms duration is very low. So there is a big problem of the Zika virus. What is the problem? Zika virus is that Zika can be passed from the pregnant woman to her fetus. So infection during pregnancy can cause certain disease, and I just mentioned one disease, that's a microcephaly. In the microcephaly, the baby is born with the very small heads. You also observed in your locality. This is called the microcephaly. This is a disease which is caused by the Zika virus. I also mention the World Health Organization report. This is a statement of the World Health Organization. That's from 1st January 2007 to the 6th April 2016. Zika virus transmission was documented in a total of the 62 countries. So this is a very big problem, and in the recent years, that's 2016, the Zika virus also spread in the America and in the Brazil. So I studied about the Brazilian, so that there is a fact of in the Olympics due to the Zika virus. That is a very big problem. So what is the precautions? Because you know that there is no any medicines or drugs are available for the treatment of the Zika virus. So the thing is simple, that you have a precaution from the Zika virus. So what are the precautions? First precaution is that you should away from the standing waters. That's a remove or stay from the mosquito breeding sites, like container with the standing waters, like you have observed that in the pools where standing water is present, you should remove these standing waters or away from the standing water, because there is a chance of the breedings of the mosquito in these wastewater sites. And the thing is that this is simple, the local government responsibility, that it sprays in your locality on the monthly basis, and the responsibility of you is that you also spray with the mosquito killers in your home or weekly basis, at least the weekly basis. And the thing is that wear long dresses with the long sleeve shirts and the long pants, because the mosquito bite sites are not available, and you this is a very important precaution from the um, Zika virus. So simple is the conclusion of my presentation is that no vaccine exists to prevent the Zika virus. So simple thing is that prevent Zika by avoiding mosquito bites. So thank you very much. For more videos you can subscribe my channel.